Malawi in February 2022 registered a viral polio virus type 1, 30 years since the last in 1992. Since that, of course, there was a lineage or a link to a Pakistan similar WPV1. However, since that last time, we have not had any WPV1, but of course, over the course of the months or the past year, we have also registered circulating vaccine-derived poliovirus type 1, but also circulating vaccine-derived poliovirus type 2 in our environmental sample.
2007, when I started handling, it was really tough because after detecting a sample from a district or from a health center, the sample is transferred to a district whenever there is availability of transport. It took almost some 6 weeks for a sample to move from a health center to arrive at this place. And it was really tough. And a lot of our samples, although we said they were adequate, they were collected between 0 and 14 days of onset of paralysis, but they were reaching a lab almost after 2 months.
We do have a number of cross-border cases, and just to mention that the 2 positive polio cases that were identified here in Palombe are also coming from Mozambique.
Global Polio Eradication Initiative, WHO was deployed and the budget was actually supported directly through WHO to actually deal with the responses surrounding polio outbreak. We have had now 5 rounds, and throughout, WHO has been key in making sure that we have quality response activities, but also in between there has been several activities happening, including that of surveillance.
WHO played the lead role, seeing that the surveillance was not strong enough, so it brought a surveillance enhancement plan to be able to address all the critical components of surveillance, working closely with the partners again on this. So some of the activities that they did was really to enforce active surveillance, training of health workers, and particularly establishing environmental surveillance in the country. Currently, have about 6 in 6 districts and 10 sites. The cross-border surveillance was very, very important because of the border areas. So with all this, we were able to detect cases crossing the border from Mozambique and reflecting on the same, and even the AFP cases we were also able to detect. The environmental surveillance was able to pick a CVD-PV2 case in this year, and the sample was collected in January. So overall, it has strengthened the system. The indicators are quite good, well above the target levels across all the districts, most of them, compared to what we had.
When a health center has detected a case, one of the health workers from the health center uses his own transport to carry the sample from where he is direct to this place. And now we are able to say we can ship daily.
During this time, we had a WHO stop officer, so he provided the technical support. So we had to go with him to do the investigation. In addition to that, we were going through the facilities together with the WHO stop officer. This WHO stop officer helped to mentor our people in the facilities to make sure that they are able to detect any AFP cases that are found in the facilities. He mentored most of the facility teams, including myself as the focal person of the district.
We are trying our level best. And now the lead time has dropped from 42 days to 2 days. And when we are saying 2 days, it means we are referring to cases from almost 700 kilometers from here. But for cases within Ilorongwe, within 2 hours after the collection of the second sample, the samples are here. So there is a great improvement.
Malawi was certified free, had a polio-free certification since 1992. So that's been a long time, and there was no polio outbreaks for a while, no response campaign. So really, it's not something that they were used to, unlike other countries. So it was kind of a new thing for a new set of people leading the program at the time. So it needed a lot of capacity to build, and even to engage the communities on the urgency and the need to be able to address the polio outbreak response. When the WPV case was detected in February 16, WHO's response was quite fantastic. With the GPI, the response, they deployed teams immediately. There were really teams on ground to respond. So that was good, and really bringing all GPI partners to be able to support the countries. Once in country, they work with the country to declare public health emergency of international concern and try to immediately start preparing an outbreak response plan and how to address this in the most timely manner to interrupt the transmission.
Togoza WHO molumikizana ndi achipatala kubweresa katemera ameneyu kuti athandize kumuzi kuno ana kuti asapuwale ziwalo zawo pamene anabadwa ali abwinobwino.
There was an impact because of the presence of the WHO officer. There was a change in the detection of AFP cases.
WHO assisted in the purchase of these. These are sample collection bottles. For us to be able to ship samples from Malawi to Republic of South Africa, we need these triple packages. WHO has also been key in the protection of printing, distribution of the AFP case investigation forms. Without the AFP case investigation forms, this program can be a flop. In Malawi, it's WHO alone that supports surveillance.
It was very unfortunate that from nowhere we identified a case of a child. We quickly alerted the WR and they quickly came in to assist us. And to date, we have done 5 rounds, of vaccination, and we're so grateful because we didn't even have the vaccine in the first place. We could not have done it on our own. We couldn't. But because of the collaboration, and we were having weekly meetings, just talking, to see how best to do these things. And they also coordinated for us to have the technical support from the Global Polio Eradication Initiative. They are still in the country, but they were able to come in because of the support from World Health Organization.